Hello, my name is Dr. Brian Raid, and I am a naturopathic doctor. And this is a video about herbs that I have found in my practice to be somewhat more common than others in terms of causing adverse reactions to folks that are taking them. A lot of these herbs I find are well tolerated by the vast majority of patients. Of course, prior to prescribing anything, we have to take into account any interactions with medications or just individual circumstances for those patients. But in my experience, some of the herbs that have caused the most grief for my patients, if you will, would be berberine. So berberine is an alkaloid. It's present in a number of different herbs, things like barberry or Oregon grape or something called chanca piedra, different herbs that are out there that have berberine in there. Golden seal would be another one. And what I found in my practice is that a lot of patients tolerate berberine just beautifully. It's no problem at all. It's something that's specifically indicated for hydrogen gas producing SIBO, small intestinal bacterial overgrowth. And it's something that I find 95% of the time, no problem, but 5% of the time, patients just really have a hard time tolerating it. They might get nauseous or they feel unwell in some way, shape, or form. And so, of course, anyone listening to this video, please defer to your healthcare provider. So if someone has said to you, please take berberine, I'm not saying stop your berberine by any stretch of the imagination, just saying that in general, as a point of interest, berberine is more of it's one of the ones where if someone says to me like, I'm not feeling so well on that, I'm taking berberine, I'm not incredibly surprised. Like, oh, it doesn't happen too often, but it's certainly one to be a little more mindful of. Another one that I found in my practice that can sometimes be more aggravating or triggering for folks is the herb cloves. I'll regularly use herbs in a tincture form, so an alcohol-based extract. To help address certain types of SIBO. And cloves are one that I use pretty often. Cloves seem to pack quite a strong punch. They're quite strongly antimicrobial. They seem to work across a range of SIBO species, and they also can be clinically effective against yeast and parasites. So you get this really beautiful broad spectrum treatment with cloves. The thing with cloves is that they're generally quite well tolerated, but if patients have a history of heartburn or reflux or gastritis or something like that, they have cranky stomachs, if you will, then cloves is quite commonly something that will irritate them. So that's will exacerbate or increase those symptoms. So that's one that I'm always really mindful of, and I usually just don't bother prescribing it if they have those underlying issues, although some folks might do just fine with them. In terms of other herbal formulas that are commonly used in SIBO that can be more problematic than others, that would be enteric-coated or sustained release essential oil formulas. And again, just like with the cloves, if a patient has a history of heartburn, reflux, gastritis, something like that, I'm really mindful about prescribing those in those particular patients because they it might be more common that they might have an exacerbation or a flare-up of those types of symptoms. Also, essential oils are just really, really strong. So it's something where even if a person doesn't have a history of heartburn or reflux or whatnot, I'll still recommend they build up their dose relatively slowly, usually, starting with oftentimes even just a 10% or even sometimes say a 6% of a full therapeutic dose, and then we'll build it up incrementally to make sure they're tolerating it well so they don't get a big SIBO die-off reaction, which is no fun. I wouldn't classify a die-off reaction as being kind of a side effect or an adverse reaction. It's certainly fun, and I'm adverse to having side effects like that personally, and I don't like to see it in my patients or flare-up symptoms in my patients, but it's something that I think is in a separate category where we're just likely killing things off too quickly. So those are a few herbs that I just are kind of on my watch list. They're on my radar to be a little more conscientious with, that some folks might not do as well with them as others, but I've used them many, many times in hundreds of patients, and they can work really well in well-selected cases.